Hello, dear friends. If you are watching this in real time, it is the month of February. And February is the only month in the Western world that's actually associated with an organ, the heart. So if you haven't deducted yet what our topic will be for today, it's going to be on integrative heart health care. And if you know me well and have been watching some of my videos, you can probably already guess another topic that I'm going to interweave into this one, and that is how essential oils support our cardiovascular system. So, if we think about why February is associated with the heart, many of us will think of the fact that Valentine's Day falls on February 14th. And no, it is not a conspiracy to earn more profits for the chocolate, flower, and greeting card companies. It actually has a vast cultural history in both Christian and ancient Roman traditions. And it's a day that is dedicated to celebrating romantic relationships as well as showing our gratitude for those we care about. But this month also draws attention to the cardiovascular system because it was designated that way. American Heart Month was proclaimed by President Lyndon B. Johnson on December 30th, 1963 by Proclamation 3566. So interestingly, this co-occurrence of an unofficial holiday that's centered around love and the promotion of heart health is connected in a meaningful way, even if it was unintended. And that's because research shows that strong relationships can help protect against cardiovascular disease. In other words, connection and community can heal the heart. Now, unfortunately, even though there was an intent with this national decree to place more focus on how to keep our pumping organs thriving every year, it hasn't been improving our poor heart health outcomes. In fact, the CDC states that we still have cardiovascular disease as the leading cause of death in the United States. And the actual numbers are pretty stunning. It equates to about one person dying from heart disease every 34 seconds. So it's become blatantly clear that we need a new approach to improve our cardiovascular treatment. So what I want to do today is what I've already discussed is look at some of the most important information to consider when we're talking about caring for our most beloved organ. And I want to point out where conventional medicine is missing the mark in healing our hearts. And then I also want to discuss how essential oils can benefit our cardiovascular health. So we're going to go through risk factors for heart disease, both uncontrollable and modifiable. We're going to talk about the great cholesterol debate, the benefits and side effects of statin drugs, the mind-body heart link, the gender gap in cardiovascular care, how essential oils benefit cardiovascular health, and the importance of community and relationships in healthy hearts. So this is going to be a little bit of a longer video, but it's going to be inclusive of, I think, everything that you will need to know regarding cardiovascular health from an integrative perspective. And then you can dive deeper if you want to look up the details and studies and go a little more in depth with each of these topics with the links and the references that will be available in the accompanying article to the video. So let's get started. Let's look at first what we can control as far as what our heart disease risks are. And common risk factors that are quoted by the WebMD and common medical journals as well as medical blogs are things such as smoking, unhealthy cholesterol numbers, high blood pressure, physical inactivity, having a BMI greater than 25. This is more of an association study, but again, there's a lot of diet culture influence here. Uncontrolled diabetes, blood sugar is related to heart health. High C-reactive protein, which is an inflammatory marker, so uncontrolled inflammation, uncontrolled stress, depression and anger and emotions are linked to heart health. So getting our emotions where we're able to handle them and process them is important for our hearts. There's actually physical reasons for that. Diet factors, alcohol use is linked to heart health, and then there's a very important factor that's not here that we're going to discuss in a little bit regarding relationships and community. Now, there's some things that we can't control. If you're male, if you're postmenopausal, if you're older, if you have a family history of heart disease, your race, such as being African American, Native American, or Mexican American, and your genetics, those can be risk factors that are in your control related to if you're going to have a greater chance of a cardiovascular event. But again, those aren't determinants, those are just risks. Now, the American Heart Association has a checklist of what they call the Life Essential Eight, and they just added an eighth to what was originally their seven factors, which included nicotine exposure, physical activity, diet, weight, blood glucose, cholesterol, and blood pressure. So similar to the risk factors. And then they added sleep as the newest addition to round out that eight. And clinically, the American College of Cardiology actually offers a calculated measurement for physicians to determine their patients' risk for cardiovascular events in 10 years. This is called the Atherosclerosis Cardiovascular Disease Risk Calculator. It's based on age, sex, race, blood pressure, history of diseases, lifestyle factors, and cholesterol levels. So there's many factors that are related to heart health. Cholesterol by far gets the most attention. So I wanted to kind of draw that in here and look around why cholesterol gets so much attention, and also the contentious debate really between integrative practitioners and conventional medicine on why not everyone agrees that lower is better in regards to cholesterol. So your body actually requires cholesterol to synthesize vitamins, other hormones. It makes up our cells. And the relevancy of having high cholesterol in relationship to heart risk is contentious because there's been mixed reviews in the literature. Some have found lower cholesterol actually is less risk. Some have found it makes no difference. Some have found higher cholesterol actually is a lower risk for heart disease. So it's complicated, and even the fact of how to treat it is also contentious in the medical world. But if we look at overall health and high cholesterol and heart, there are many interwoven factors that can come into play about how that high cholesterol in the body is going to interact with our blood vessels and our heart. And an integrative naturopathic and medicine perspective includes the consideration of these factors. They include things such as inflammation levels, endothelial, which is blood vessel, the health of the blood vessel lining, one's microbiome, the gut bugs, lipid particle size and protein levels. So it's not just the cholesterol itself, but also what the how big the cholesterol is and what the different protein levels are and the particle size. Blood sugar and insulin levels will determine how inflammatory cholesterol will be. Dental health, inflammation in the mouth can go systemic to the heart. Immune health and susceptibility to infections is a factor for cholesterol. Lipids can actually bind to microbial toxins and neutralize viruses, among other defense things that cholesterol can do. So sometimes cholesterol is a healing response after an infection when it goes up. Environmental toxins can raise cholesterol. Low thyroid was actually one of the major factors before the invention of statin drugs that doctors would consider for high cholesterol, because thyroid hormones is needed for cholesterol utilization. If someone is absorbing, excreting, and producing cholesterol effectively will determine the number. Liver and digestive health, and then dietary cholesterol, which is another subject of debate because not everyone is sensitive to cholesterol in the same way. It's based on genetics and how you excrete cholesterol that determines whether or not what you're eating really affects that number to an extent where you would need to get those foods and saturated fats and lipids down. So the fact that cholesterol levels can rise or fall based on so many different biological processes and external triggers is actually why there's so many different viewpoints on why people can't agree if we should lower cholesterol, how low should we go, if we should just leave it alone. So one of the first things as a naturopathic and functional medicine doctor that I do is I actually seek out to find why the cholesterol may be high in the first place. And unless they're dangerously high, there's a genetic disorder, we usually want to address the root cause. And sometimes while we're doing that, we might address the symptom of the high cholesterol, whether it be through medication or a supplement. So if a patient or client might have chronic infections, right, and their cholesterol is high, we might want to look at their immune system and look at how to help their body clear out that infection and see if that was affecting cholesterol. And this would be determined through other maybe lab tests and symptoms that show that they have a history of a chronic infection or virus. When the microbial populations are back in balance, we might want to look at to see if they still need treatment for high cholesterol. Another instance, one of the most diagnosed and missed issues with high cholesterol, especially in women, is low thyroid. So if we just suppress cholesterol, which is actually trying to make more thyroid, right? Because we need cholesterol to make hormones. If we just suppress that, we could actually be covering the symptom and making the underlying cause worse, especially because low thyroid is becoming more common with all of the environmental toxins we're up again and all the stress that can downregulate the thyroid. So we want to look at the thyroid and then assess hormone balance. And once this underlying issue is resolved, we'll still kind of look and see as once the thyroid is back in balance, if the cholesterol levels went down naturally and if they still need treatment, because we don't want to overtreat when it's not needed. So speaking of treatment, here's where there's another controversy in heart health. So risk factors are pretty much agreed upon, except a lot of people miss some of the most important ones. But the ones I mentioned, most people agree on. People agree cholesterol is a factor, but how much it's affecting is determined by these determinant factors that not everybody is aware of. And then another S word along with cholesterol is the statin drugs. So I don't really want to go into a long diatribe about the different experiments and the research. I think I'll just go by the numbers here because that's easiest. And if we look at the number needed to treat, which is NNT, and the number needed to harm a person from taking a drug, these are based on research and literature. We can look at the number needed to treat to help out somebody from preventing either a non-fatal heart attack, and then what would happen if, as far as harms that would cause by that person taking the medication that didn't really need it, or if they were taking it for prevention, what would be the risks? So as far as the number needed to treat for 5 years for someone is just primary prevention, their cholesterol is high, they never had that a heart disease event, and maybe their family history really isn't that alarming, their risk factors are low. There's 104 people needed to treat for every one person that's safe from a non-fatal heart attack. So it doesn't even cause death. And then as far as harm, 1 in 50 people that take the medication can develop diabetes, and 1 in 10 can have damage to their muscles as a side effect. Now, for those with known heart disease that are taking a statin, they've already had cardiovascular disease or the heart attack diagnosis. 1 in 39 non-fatal heart attacks are prevented for people taking the drug, and 1 in 83 lives are saved. And then the number harmed remains the same, as 1 in 50 can develop diabetes and 1 in 10 can have damage to muscles. So the bottom line is that statins may help some people, that you need 104 people to actually take the drug in order for one non-fatal heart attack to be prevented. And so you have to weigh this with risk versus benefits. When we look at side effects for statins, these include things such as muscle damage, muscle soreness, blood sugar dysregulation, and neurological impacts that can occur. Now, some of these can be mitigated because some of the reasons for these are drug nutrient depletions. The drug actually depletes some of the nutrients to be processed by the liver and metabolized. So for example, if we replete CoQ10, it may help with some of the muscle soreness that occurs with statin medication. So that's the cholesterol debate. That's the looking at statin drugs, the main treatment for cholesterol. And there's different drugs and supplements and lifestyle interventions that are the main focuses for promoting health in conventional medicine. Things that are missed are relationships, socioeconomics, and emotions, and they're just as essential. We look at relationships, they are a key mediator for predicting mortality in someone with heart disease and other co-occurring symptoms related to heart disease. For example, perceived loneliness and isolation are now validated as substantial risk factors associated with cardiovascular mortality, and lack of social support has been found to correlate with high inflammation, which causes strain not just on the heart, but on the whole body. Furthermore, all of these non-conventional factors like relationships, socioeconomics, and emotions are also linked to increases in compounding one's risk for heart disease and compromising recovery, specifically mental health issues such as depression and anxiety. On a positive flip side, healthy relationships decrease the risk for one suffering from a repeated heart attack and can buffer the negative strains of the heart. There's a study called the risotto effect, which actually looked how strong community bonds in this city risotto led to Italian immigrants to have lower rates of disease. And this was despite them having unhealthy habits. So their strong communities and relationships actually trumped some of the lifestyle factors for protecting their heart health. So we can't optimize heart health with a drug or supplement or lifestyle if we aren't looking at some of these other factors. We have to look at psychology, we have to look at social determinants of health. And there's another thing that we're missing in cardiovascular care, and the fact that cardiovascular disease is often under-recognized and under-acknowledged in biological women and minorities. And this is because these populations may present with different symptoms than those that are typical, more recognizable warning signs of heart problems. And there's also a misperception that heart disease is mostly male gender disease, when many women actually are aware that cardiovascular disease kills more people than breast cancer. So doctors and patients are often mistakenly attributing signs of heart issues that could look like hormonal, digestive, or mood imbalances to those actual issues when there's really an underlying heart concern. So we need more people to be aware of these aspects because women tend to be more dependent on emotional connections than men, and their hormones also affect the heart. So it's very important to consider the heart as a prominent player for women's health. Recently, there was a study that also reported on several additional cardiovascular disease risk factors associated with heart disease risk in women, and they weren't biologically based at all. It was economic stability, neighborhood safety, working conditions, environmental hazards, education level, and access to healthcare. And all of these are upstream precursors that are often being ignored. They're actually critical to address before one can change the lifestyle shifts and move the needle on some of the other factors that are risk factors for heart disease. So we need to go more upstream. So the bottom line is that socioeconomic factors, access to wellness, nourishing food, stress management, lifestyle education, social connecteds, community support, and mind-body medicine techniques are needed. And we need to bring as much attention to those as we are to cholesterol, or else we're just never going to dig ourselves out of this hole of cardiovascular disease being the number one cause of death in the United States. All right, so we looked at risk factors. We looked at often ignored risk factors, relationships, communities, and misdiagnosed and underappreciated populations that have heart disease. We looked at also the cholesterol and if that's importance with determinants that can determine if high levels are going to be a problem in some of the underlying causes of the high cholesterol, and also the statin debate. Now I want to talk just a little bit about essential oils before we wrap this all up in a bow. So, as love and mood influence our neurological signals and our emotional brain, essential oils can do the same thing because they can literally stimulate love and heart health. Because they actually enhance emotional resiliency, they provide stress relief and hormonal balance. And all of these, when they are in alignment, help for better intimacy skills, being more present for the people that are around us, and stronger relationships. And then we can relax and let love in. And along with these mind, body, soul, and stress relief benefits, essential oils can additionally support heart health through their biochemical properties. Their molecules mediate various triggers that lead to poor circulatory function. They're anti-inflammatory, they act as antioxidants, they promote circulatory flow, they mediate neurotransmitters and hormones, they boost immune response, and they help the body detoxify toxins. They also do a lot more. Balance blood sugar. They also, again, help with emotions and stress and sleep. So all of these are important factors that essential oils can help with to boost our heart health. I did a podcast that went over all things related to cardiovascular care and how essential oils support and address under-recognized triggers of heart risk factors, modulate heart disease risk factors, and balance the mind-body-heart connection on my podcast, The Essential Oils Revolution. And I will have that link in the video description article so that you can go to that if you want more information. In that actual episode, I also highlighted some of my favorite single essential oils for heart health. So if we wrap up the heart, brain, body link and essential oils for better cardiovascular health, we want to consider that heart disease continues to be the number one cause of death in America, and that there's unmodifiable and lifestyle factors that can contribute to cardiovascular risk. But some of the most important influences, such as socioeconomic conditions, mental health, and relationships, are often ignored, and they need to be brought front and center. So we need an integrative approach if we're going to change all this, and it should be personalized, holistic, and address the root causes of cardiovascular disease, not just treat one symptom, such as high cholesterol or inflammation, without looking at where it's coming from. So in my opinion, there's three main areas of focus that we can do nationally and globally to improve heart health. It includes fostering social connections, which are essential for cardiovascular care, so as important as lifestyle supplements and drugs, emphasizing mind-body approaches such as essential oils, which can promote emotional and physical wellness and stronger, healthier relationships, and form wellness communities to help people connect to other like-minded individuals with the common goal of optimizing mind-body heart health. Now, before we end, I want to highlight the last point of emphasis is on wellness communities. And this is something that I take seriously, is how often the power of connection is ignored in medicine. I actually created my own community membership program, which leverages on this power of connection, even though it doesn't replace face-to-face, still being in the vicinity of like-minded individuals who are also into essential oils or holistic health, and you can discuss with them in a community forum. You can learn more about some things of interest for overall health. Now, my focus is mostly on essential oils. In the membership community, I have a full course curriculum, a database, a question and answer with me on essential oils, but there's also more just comprehensive naturopathic and functional medicine topics as well. So if you are interested in that, there will be a link again in the accompanying article on my community membership. There's a small monthly fee, or you can save and actually subscribe for the year for $125, cancel anytime. So that being said, I want to thank you so much for taking the time to learn how to nourish and nurture your mind, body, heart, and soul. And I would love to hear from you on some of the things you do to care for your heart and what other topics you would like me to cover on this video, because the whole point is to help you out and to support you and to help build your communities. Have a beautiful day and take gentle care.